aimed at ramping up coverage to at least 50% of our eligible target population by 31st of January 2022. This is coming on the heels of the first and second rounds of vaccination that focused on the strategic leadership, frontline medical workers, and other eligible citizens. You will recall that the national response to COVID-19 pandemic commenced early in March 2020, shortly after the index case was recorded. Through the concerted efforts of researchers, humanity rapidly advanced the global response to the discovery and deployment of vaccines to control a virus that had mutated into deadly variants and cumulatively caused over 5 million fatalities, according to the statistics released by the World Health Organization. The federal government, as part of its duties and commitment to the welfare and safety of Nigerians, spared no effort in accessing vaccines which were deployed in strategic manner so that the impact of the virus on all facets of our national life would be minimized. In addition to vaccines donated to our country, huge resources have been committed to ensuring that, one, our citizens have access to effective and safe vaccines. Two, awareness was adequately created to ensure that the vaccine hesitancy was minimized. Three, strategy was developed to target the vaccination of at least 70% of our eligible population for herd immunity. Four, infrastructure was developed nationwide to support the supply and delivery chain. And five, adequate manpower was recruited and trained to deliver the vaccines. Six, protocols were developed and updated regularly to minimize the risk of internal spread and importation of the virus. Seven, technology was deployed to keep records of the vaccines administered, people vaccinated, and ensure that side effects were adequately monitored. Eight, building health infrastructure and human resources to safely bring the process closest to our eligible target population. Nine, strict measures were taken to prevent fake vaccines from getting into the system. And lastly, 10, a futuristic measure, preparing traveling Nigerians for the emerging trends which require full vaccination as a precondition for travel to certain destinations. The list is inexhaustible. I wish to seize this opportunity to appreciate all Nigerians, especially those who have stepped forward for their full doses of COVID-19 vaccines after the first and second phases of the campaign. I urge them, as patriotic citizens, to remain in the army of foot soldiers against hesitancy and misconceptions. In spite of these unparalleled levels of commitment and the achievements recorded in the first and second phases of COVID-19 vaccination campaign, I must inform Nigerians that we are far from achieving the national target of vaccinating 70% of our eligible target population to move Nigeria towards attaining herd immunity by 2022. Ladies and gentlemen, this realization of the low level of vaccination and developments around the world have combined to drive the adoption of COVID-19 mass vaccination campaign strategy that will ramp up COVID-19, the numbers of vaccinated people around the country. Your Excellencies, it is important to mention that through this mass COVID vaccination campaign initiative arrangements have been made to ease all known bottlenecks to access, because the National Primary Healthcare Development Agency has expanded vaccination sites. These sites include public health facilities, private health facilities, mobile vaccination posts, and mass vaccination sites such as schools, markets, shopping malls, recreation centers, motor parks, worship houses, and other public places that attract high human traffic. Nigerians are assured that the National Primary Healthcare Development Agency has also taken stringent measures to provide any compromise of the process along the value chain. This vaccination is free because government remains conscious of its responsibility to safeguard the health of our people. Let me at this juncture remind Nigerians that the vaccine mandate policy has become a global phenomenon, and Nigeria is not an exception. All federal government employees are therefore reminded that December 1st, 2021 remains the deadline for all to show evidence of being vaccinated fully or a PCR negative test result done 72 hours before being allowed into government facilities, particularly their offices. I therefore urge all public servants that are yet to be vaccinated to take advantage of this mass vaccination to receive their vaccines in order to protect themselves and their loved ones. Remember, no one is protected and safe until we are all protected and safe. Let me commend our governors, the Federal Ministry of Health, and the National Primary Healthcare Development Agency, our development partners, and other stakeholders for providing leadership, oversight, and committing to drive this initiative that will ensure that all eligible Nigerians are vaccinated within the shortest possible time. I urge all stakeholders, therefore, to mobilize community members aged 18 and above, especially the elderly, to get vaccinated against COVID-19. I also urge Nigerians to, after vaccination, continue to observe the non-pharmaceutical measures, that is the wearing of face masks, washing of hands regularly, either by soap or making sure that you sanitize your hands by the use of hand sanitizers, maintaining physical distancing, and as much as possible, avoid congregating in large gatherings until we have vaccinated enough Nigerians to achieve herd immunity. Distinguished ladies and gentlemen, it is now my honor and singular privilege to officially flag off the COVID-19 mass vaccination campaign in Nigeria this Friday, 19th November 2021, to the glory of God and the benefits of our citizens and mankind by extension.
So with the massive rollout in the public and the private sector, we have also developed the strategy that we call SCALES. The acronym SCALES has a very important component that looks at supervision. So we have also rolled out a rigorous supervisory process that will make sure that before any private health facility is engaged in the mass vaccination program, that there is accreditation. So there are some basic standards that must be achieved by the private sector before we will allow them give the vaccination. Just because we do not, at this late stage in the rollout, compromise the high standards that we have maintained when we rolled out in the public sector. We know that the private sector is very efficient and will be leveraging on their efficiency, on their technologies to make sure that our vaccination program continues to be seamless. It is a lot of work that needs to be done, but that is exactly why we're here. That is why we're ambitious that before the end of January 2022, we'll be targeting 50% of our eligible populations. We've had a lot of conversations within subnational level, and we're all fired up to make sure that now that the jabs are available, people will get the vaccines wherever they live or work. So right now, we have in the pipeline, so when you talk about logistics of vaccines, you talk about vaccines that are in the pipeline. So vaccines that have been committed between now and the first quarter of 2022, we have been able to secure up to 100 million doses of the vaccines. So we expect that with 2 doses, that approximates to about 50 million Nigerians, right? And when we know that we're going to be targeting 112 million Nigerians, that's right around 50%. But even beyond what has been committed, we are also aware that additional donations are coming. So we are working with our donors, with the COVAX facility, our development partners, to make sure that we manage these vaccinations in a way that we will optimize the donated quantities, so Nigeria will not have to spend too much money buying vaccines. So apart from the original 40 million or so J&J vaccines that have been procured, we do not plan, at least at this moment, to procure additional vaccines. Vaccination launch, the flag-off ceremonies that are taking place, they are symbolic flags off to demonstrate increased awareness that we now have mass vaccination sites, right? So these mass vaccination sites are going to be set up in every part of the country. Right now, for every political ward, you have a designated primary healthcare center that has been given the vaccines to vaccinate all Nigerians. Where there are accredited private health facilities as well, these private health facilities will be giving vaccines to vaccinate. So at this point, now that the vaccines are available, we're rolling out to the most hard-to-reach areas. A lot of these operational aspects will be handled by the subnational level. We're providing them with the support to make sure that they are able to get the job done. And we're confident that with the clarion call that we've made to governors to also flag off and provide leadership in their states, that the vaccines are going to be available, we are sure that the governors will also replicate what has been done today by flagging off and also charging the stakeholders, traditional leaders, religious leaders, opinion leaders, political leaders, to make sure that people are brought to these vaccination sites, to the designated health facilities to get their vaccination. One thing that we keep saying is that 6 million Nigerians have been vaccinated. 6 million Nigerians cannot be wrong. 6 million Nigerians are safe and protected from severe forms of COVID-19, from death from COVID-19. The data is very clear. The evidence is now overwhelmingly clear that the COVID-19 vaccines are protective. We have seen the contextual data that exists within Nigeria. Over 80% of people who are dying from COVID-19 in Nigeria are those individuals who have not had their vaccination. This is really the evidence that we need to inform Nigerians that the vaccines are safe, that they are effective. One thing that we also have been telling Nigerians is the fact that these vaccines have some side effects, but these side effects are very minimal. Over 95% of people that take the vaccines come with no side effects or minor side effects, such as pricks, a little swelling. Those are discomforts that we can bear, right? But for the most part, these vaccines are effective, they are safe, they are now available. Nigerians need to seize the opportunity to take the vaccines so that we can now begin to go back to normal lives. I know a lot of my friends, a lot of my relatives who say they're tired of wearing the face mask. They're tired of all of these restrictions, social restrictions. Well, I keep telling them, the answer is for us to reach herd immunity so that we can go back to normal lives. But it is also important that everybody talks to their friends, to their relatives, to their family members, so they can get the jab. That is the way that we can ensure a massive swell of people that have been vaccinated in Nigeria.